Hi, welcome back to What's Up Doc. My name's Dr. Michael Cohen. I'm a family medicine specialist. I wanted to talk today about a subject that's very close to my heart, which I've called my friendly tic, a helpful imperfection. You'll probably have already noticed, and you will definitely notice during my videos, that I have what's known as a motor tic. You'll probably notice me moving like this, or doing all sorts of funny movements with my face and my neck. And actually sometimes I do them with other parts of my body. So my stomach, I can move around, I can twitch around like this. So the difference between a tic and a twitch is that a tic is actually suppressible for quite a while. So what happens is that when, for example, in my own case, when I feel a tic coming on, I can sort of push it down aside and I can sort of feel it building up, building up, building up. But while it's building up, I can control myself. However, it usually reaches a point when I can't, and then the only way to relieve the feeling of the tic is to actually perform the tic. So for example, if I have a feeling here in my neck and it's feeling like it's building up, building up, building up, then I have to go like that. So there is a conscious suppression of it, but at the same time, it's very, very difficult to actually suppress. And there are other methods like distracting yourself from it. With a twitch, however, this is really not in our conscious control. This occurs usually because of some kind of lesion of a nerve or some pressure on a nerve. For example, you may have seen somebody with a torticollis whereby their neck is held like this, and often it's quite painful. And that's usually caused because a nerve is trapped in a muscle fiber or because of a degenerative disc in the neck, which is now pressing on a nerve. And this actually causes a constant stimulation of the nerve, and the muscles contract to keep you in that position because if you move, it's actually painful. So that's a part of the reason for that happening. But the distinction is very much that tics are somewhat suppressible, at least for a period of time, and that twitches are not. So an example of a twitch is, I'm sure you've all seen people's eyes go into spasm, whereby you see them going like this. So the eyelid going like that. And that can go on for seconds, hours, days, or even weeks sometimes, constantly or intermittently. And again, that's not something in one's conscious control. So in terms of the classification of tics, there are two types, basically simple and complex. And tics take the form of either motor or vocal tics. A motor tic could be the movement of a limb like this, and a vocal tic could be making a sound like something like that. So I'm going to tell you about my tics. They started when I was quite a young child, I guess. I don't remember exactly when they started, but I do remember experiencing them in different times of my childhood. And I remember that at times they presented a bit of a problem for me, in which other children would make fun of me. The classic one that I would have done would have been a neck movement like this, but sometimes it would also have been some kind of squeezing, writhing movement of my abdomen. Sometimes it would have been moving my arms suddenly. And again, to go over what it feels like, it really does feel like a build-up of tension in one area of the body, which you just suppress, 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 and then it just has to be performed. It has to be released. The tension has to be released. And once you relieve it, it settles down for a while, and then it happens again. Now, it could recur again in exactly the same spot in exactly the same way, or it could take the form of another tic in another part of the body. I definitely have periods when I have more tics, and those tend to be when I have had less sleep. And as it is, I'm not someone who's the greatest sleeper. I don't sleep for long periods of time. I tend to have quite a lot of energy without sleep. But I think that for myself, the price I might pay is this. And the tics that I have, so they do get worse when I don't have sleep. I'm pretty sure they get worse when I drink more coffee or caffeine than usual. I think that they actually get better when I exercise, and I tend to exercise every day. I've also noticed a couple of other things that I've tried, one being magnesium supplements, and another thing being omega-3 supplements. Now, in both of these cases, these were done under medical supervision. I had blood tests, I spoke to a doctor, We started me on supplements and monitored to see how I was doing after a month or two. And I'm pretty sure to say that both magnesium and omega-3 did help me. But again, these were done as a kind of experiment that I did on myself. Alcohol is obviously something that a lot of people will think about. Does it help or not? And I think for myself, at the very least, alcohol does help. But obviously, I'm not going to go around drinking alcohol all day long. It's not a particularly useful way to live. But I think it definitely does suppress the tics, which comes onto the subject as to what's actually influencing them. So apart from the fact that we know, certainly as a theory at least, one of the strongest theories about why they happen is because there is some overactivity or oversensitivity to dopamine in the brain, affecting areas of the brain which control movements. Things that actually have an effect on that system are if a person is tired or not, whether they've been drinking coffee or not, whether they are stressed or not, whether they've been drinking alcohol or not. Alcohol, probably because it's a depressant drug, it also relaxes a person somewhat, and therefore it will probably help with motor tics. It seems that stimulation of some sort does worsen it. However, for a long time, it was thought that, for example, drugs that are used for attention deficit disorder, they're stimulants themselves, and it was thought that they worsen motor tics. And more recently, evidence has shown that it's not so clear, and perhaps they don't actually worsen motor tics. One of the most well-known tic disorders is known as Tourette syndrome. So a lot of people have heard about this, and it's unfortunately quite famous, as it were. Tourette's is famous because the classic person with Tourette's is someone who has a condition called coprolalia, which means that they swear without obvious voluntary control. And they come out with words in the middle of a sentence that are just inappropriate and which do cause significant social disturbance to them and can be very distressing. So this is one that's very well known, but it's extremely rare actually. However, if you look at a country like the United States, which has got around 350 million people, somewhere around 140,000, which is a small fraction of a percent, has them. But if you think, well, it's 140,000 people in one country, a very large country, but it does affect quite a significant number of people, even though it's generally rare. Then other forms are much more simple. So there are tic disorders which are transient in childhood from a young age. They typically last between 1 month and 12 months, and then they pass. They don't tend to cause huge disturbances to a child's life. Then there are others which become more chronic, and they can go on from 1 year up to many years. And then there are others that translate into adulthood as well. Okay, so I want to talk a little bit about treatment of tic disorders. So tic disorders, first of all, many people with them don't need any form of treatment whatsoever. They just learn to live with it, and it doesn't bother them too much because the tics themselves may not be that bothersome, or the person is able to just suck it up and get on with things. When they're more severe, they can be quite disturbing socially, and then there are certain things that can be suggested. One of them, the simple one, is to make sure that the person is sleeping better and longer. Another thing would be to make sure that they cut down their caffeine intake or even get it down to close to zero. Another thing would be to tell them to do sports on a regular basis. My own experience has told me that both magnesium and omega-3 supplements can be helpful. Again, these should be done with some medical supervision. Don't do this on your own. And then, depending on how severe the tics are, there are also medications that can be used. However, the medications often have quite significant side effects, and I think that they should only be reserved for people who really are quite severe and who don't manage to control their tics in any other way. Another thing that's been used in the past and more recently is CBD, which is a form of cannabis. Again, this should be prescribed by a doctor, should be monitored, and this is not something that one should take lightly. The final thing that I want to say about treatment is that in extremely severe cases, deep brain stimulation, or DBS, has been used as well. And this is the process of, it's a surgical procedure performed by a neurosurgeon, whereby they actually insert an electrode deep into the brain from the outside, and it has a battery and a stimulator, and specialists who know how to very gradually alter the stimulation which comes from the outside of the brain through a wire into the stimulator deep inside the brain structures. And this can sometimes be used with good effect, but again, this is still something in its infancy. There was one other thing that I didn't mention, which is behavioral therapy. So there are people who will be disturbed by their tics, and one of the treatments that can be employed is something called behavioral therapy. And this means seeing a clinical psychologist to try and help a person work out coping strategies and also ways to try and minimize the tics in the first place. In general, therapy can be useful for many things, but again, it should be performed by a very competent and certified specialist. And there are, seeing as stress is one of the causes and also the exacerbators of tic disorders, therapy can be a useful way to process both the stress that causes the tics and also the stress that results from having the tics and having to deal with them. So it is very important, as with a lot of the subjects that we're going to talk about in these videos, that you do actually see a doctor to get a diagnosis, because not all tics are simple tics and not all twitches are just twitches. Twitches are a slightly different subject. They, being out of our control, they can represent sometimes a much more serious problem, and they do need to be checked out. If it's a simple twitch, such as the fasciculations of the eye, the little movements that I described earlier, which is also known as myokymia, then very often this is just something that will resolve when a person gets enough sleep, comes out of a stressful situation. But if it's ongoing, then do contact a medical specialist, a doctor, to ensure that you do have a safe diagnosis and nothing else that might be causing these. One of the other interesting things about tics is that they tend to result when we see other people having a tic. So if I see somebody who I just meet, or see someone in a crowd and they tend to have a tic, a little bit like yawning, that can actually set off my tics, and even to mimic the exact type of tic that they have. So this is just another interesting fact about it. Right, well, you'll notice that I'm magically wearing a new shirt. Actually, what happened is that I very much wanted to add something to this video, and it only occurred to me afterwards. The title of the video was My Friendly Tic. So why friendly for something that actually causes distress in certain situations? Well, for me, over time, I realized that my tic could actually be something that I could use for my benefit. I use it a little bit like a barometer. So when I'm having these tics, I do recognize that they're happening. Sometimes I don't, but usually I do. And when they're happening, they tell me, oh, you're a little bit stressed at the moment, or you're a little bit tired. And I can use this as a way of improving things for myself. So I wanted to bring this up because, again, with many symptoms or many problems that we may face, basically creating a different narrative, a different framework of looking at them can actually make a difference on how we get on with our lives. And I hope that this change in perspective is something that you can also apply into your lives for whatever symptoms you may or may not have at the moment. If I was to give another example of this, if you had a pain in your arm and had been checked by a doctor and it wasn't anything too serious, and yes, it was troublesome, you could either say, oh, poor me, I've got this pain and it's annoying and it's driving me mad. Or you could say, I've got a pain in my arm, there's not much I can do about it at the moment, there are certain things that might help, it may come and go. But if I look at it slightly differently, I could say to myself, well, this pain reminds me that I have an arm. I'm lucky enough that I have an arm. I should be grateful for my health and just get on with life. And I think that this kind of attitude is something that's actually helpful. We can't yet fix everything in medicine, and I doubt that there'll ever be a time that we can. We are all imperfect. We all have our weaknesses. There are times that we are better, and there are times when we are less good, weaker, ill. And we need to know how to live with ourselves and to accept ourselves rather than always trying to find a solution for something that may not always have a solution. So I think attitude towards our health is more important than anything. That's the point I wanted to make. So I hope that today's video has been useful to you, either because you yourself have tics or because you know someone else who does, and you can perhaps direct them towards treatments that may be useful. Also, because I think it can be and is very important that we learn to accept each other with our own foibles and other people's. And I think that in general, if we are accepting as a society, that in itself can reduce the stress that's caused by tics.